Hi everyone. In today's video, we are going through multiple choice question on the physiology and anatomy of the lungs. So we're going to have options and the correct answers and then a detailed explanation for choosing that answer. So we have the first question. Which structure is the main site of gas exchange in the lungs? We have A, the trachea, B, the bronchi, C, the bronchioles, and D, the alveoli. The answer here is D, the alveoli. The alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged between the lungs and the blood. Question number 2. Which muscle is the primary driver of inspiration, that is breathing in? We have A, external intercostal muscles, B, diaphragm, C, internal intercostal muscles, and D, the abdominal muscles. Now you can go ahead and pause this video to guess your answers. So our answer here should be B, the diaphragm. The diaphragm contracts and flattens during inspiration, and with this it creates a negative pressure that draws air into the lungs. Question number 3. The volume of air that remains in the lungs after minimal exhalation is called A, tidal volume, B, residual volume, C, expiratory reserve volume, and D, the vital capacity. The answer is the residual volume. The residual volume is the amount of air left in the lungs to prevent collapse after minimal expiration. Question number 4. Which of the following best describes the function of a surfactant? We have A, increases lung compliance, D, decreases lung compliance, C, promotes alveolar collapse, and D, decreases alveolar surface area. The answer should be A, increases lung compliance. The surfactant reduces surface tension in the alveoli, making it easier for the lungs to expand. So it increases the lungs compliance. Question number 5. Oxygen is primarily transported in the blood by binding to, we have A, the plasma, B, Homoglobin, C, the platelets, and D, the white blood cells. The answer here is B, the Homoglobin. The hemoglobin in red blood cells carries the majority of oxygen in the bloodstream. Question number 6. The right lungs has how many lobes? We have A, 1, B, 2, C, 3 lobes, and D, 4 lobes. The answer here should be C, which is 3 lobes. No, the right lung is divided into 3 lobes: the superior, the middle, and the inferior. And this is unlike the left lung, which has 2 lobes. Question number 7. Which of the following pressures keeps the lungs expanded within the thoracic cavity? We have A, the atmospheric pressure, B, the alveolar pressure, D, the interpleural pressure, and C, the pulmonary artery pressure. The answer is C, the interpleural pressure. Interpleural pressure is normally negative, and it keeps the lungs inflated against the chest wall. Question number 8. Carbon dioxide is primarily transported in the blood as, we have A, dissolved gas in plasma, B, carbonyl hemoglobin, C, bicarbonate ions, and D, bond to platelets. So how are carbon dioxide transported in the blood? The answer is C, which is bicarbonate ions. Most carbon dioxide is transported as bicarbonate in plasma. Question number 9. Which structure prevents food from entering the trachea during swallowing? We have A, the epiglottis, B, the larynx, C, the pharynx, and D, the soft platelet. The answer is A, the epiglottis. The epiglottis actually closes over the trachea during swallowing, and this helps to prevent aspiration. Question number 10. Which lung volume can be measured directly by simple spirometry? We have A. Total lung capacity, B. Residual volume, C. Tidal volume, and D. Functional residual capacity. The answer here is C. The tidal volume. The tidal volume, which is the volume of the air inhaled or expelled in a normal breath, is what is measured by the spirometry. Question number 11. Which part of the respiratory system is lined by pseudostratified ciliated columnar epithelium? We have A. The alveoli, B. The bronchi, C. The bronchioles, and D. The capillaries. The answer here is B. The bronchi. The bronchi are actually lined by pseudostratified ciliated columnar epithelium, and this helps to trap and move particles out of the airways. Question number 12. Which artery supplies blood to the lungs tissue itself? And this is not for gas exchange. We have A. The pulmonary artery, B. The bronchial artery, C. The coronary artery, and D. The subclavian artery. The answer here is B. The bronchial artery. The bronchial arteries supply oxygenated blood to the lungs, the trachea, the bronchi, and the pleura. Question number 13. What happens to the diaphragm during expiration? We have A. It contracts, B. It relaxes, C. It flattens, and D. It thickens and softens. The answer should be B, which is it relaxes. Remember, we talked about how the diaphragm contracts during inspiration to create negative pressure. Question number 15. Which lung volume is defined as the maximal amount of air that can be exhaled after a maximum inhalation? We have A. Residual volume, B. Tidal volume, C. Vital capacity, and D. Inspiratory reserve volume. Our answer here is C. The vital capacity. Vital capacity is the total amount of air exhaled after maximum expiration. Question number 16. Where is the respiratory center located in the brain? We have A. The medulla oblongata, B. The thalamus, C. The cerebellum, and D. The cerebral cortex. Our answer here is A. The medulla oblongata. The respiratory centers in the medulla oblongata actually helps to regulate breathing rhythm and also responses to chemical change in blood gases. Question number 17. Which of the following shifts the oxygen hemoglobin disassociation curve to the right? We have A. Low CO2, B. High pH, D. Decreased temperature, and C. Decreased temperature, and D. Increased 2,3 BPG. Our answer is actually D. Increased 2,3 BPG. Increased 2,3 biphosphate glycerate, which is 2,3 BPD, lowers the hemoglobin affinity for oxygen, and this facilitates oxygen release to tissues. Question number 18. Which pressure difference is responsible for airflow into the lungs during inspiration? We have A. Interpleural pressure is greater than atmospheric pressure, B. Atmospheric pressure is greater than alveolar pressure, C. Alveolar pressure is greater than atmospheric pressure, and D. Pulmonary artery pressure is greater than pulmonary vein pressure. The answer is B. The atmospheric pressure is greater than the alveolar pressure. When the alveolar pressure drops below the atmospheric pressure during inspiration, it allows air to flow into the lungs. Question number 19. What is the normal partial pressure of oxygen in arterial blood? We have A. 25 to 40 mm mercury, B. 40 to 60, C 70 to 100, and D 100 to 140. The answer is actually C, which is 75 to 100. The normal PaCO2 ranges between 75 to 100 millimeter mercury under resting condition. Question number 20. Which cell in the alveolar produces surfactants? We have A, type A alveolar cells, B, type 2 alveolar cells, and C, macrophages, and D, endothelial cells. The answer is B, type 2 alveolar cells. The type 2 alveolar cells secrete surfactants, which reduces surface tension and actually helps to prevent alveolar collapse. So there you have it, 20 questions on the anatomy and physiology of the lungs. If you like this video, please don't forget to give it a thumbs up, and you can also subscribe for more content like this. See you in the next one. Bye.